but there has to be a way to let them know it is absolutely fine to, and it's appropriate. It's a boundary that you are setting to tell your healthcare professional, I want this in my chart. So it is a flag that everyone will see. And it's okay to, and if you can't during the visit, because maybe face-to-face is difficult, or you're now triggered just because you're walking into the doctor's office, it's fine to send them a message or call them at a different time when you're not being triggered to say, I want this on my record. Please don't ask me about X, Y, and Z. And certainly if it's a paper chart, which I honestly miss, but I miss the days of paper charts. And we, at the front, we always were able to put a sticky saying, don't bring, this up with the patient, or they're sensitive about this. So there is always a way to do that.
Welcome to the Full Stop podcast with me, Berenice Howard-Smith, Michael Hughes and Sarah Lawrence. The award-winning Full Stop monthly podcast is an ongoing conversation that began in May 2019. Our guests bring their authentic voices to a wide range of topics that share a connection with childlessness. Our hope is that with our guests, we can help you craft your own narrative and explore what it means to be part of the childless community. You're warmly invited to continue the conversation in our online Full Stop community, which is open to all who are childless not by choice for any reason. Here you can discuss the podcast episodes, meet the guests, chat to us, and create new connections and friendships. We welcome all to listen to our stories, to inform those who do not identify as childless, so they can begin to understand and support childless not by choice friends, colleagues, and relatives. This episode spans across 3 continents with our guest, Gail Miller. Gail works in healthcare in the US and through her personal story came to realise how many exclusions there were for childless people. She identified how lack of knowledge in healthcare education on childlessness influenced how patients and colleagues were treated and vowed to do something about it. Listen to find out how. And if you work in any area where you're in regular contact with children, such as education or hospitality, you may find some of the approaches in this episode helpful to you. I do. Wish they'd kind of do different voices like Sat-Nav, because you used to be able to do different Sat-Nav voices, didn't you? I always wanted the Brian Blessed one.
Really?
I didn't know there were different options for voices. I'll have to look at that.
Used to be.
Oh, okay.
My brother-in-law loves the Australian one. So
just a generic
in the UK, but he puts the Australian one on his sat-nav. Yeah.
I've never investigated our sat-nav to that degree. I just sit there and we get along just fine. Me and sat-nav lady, we're cool. It's everyone else that gets in the car and tries to steer us off course.
And I don't know which one it is. Is it TomTom? I can't remember. But one of them, when you change it to Australian, it will say something like, g'day, some of these cliche words. And then if you've gone to a beach, it'll say, you're here. So if you're going for lunch, don't let the seagulls pinch your chips.
Really?
Yeah.
Oh.
Is that
anyway.
I didn't think about worldwide seagulls pinching chips. I always think it's a phenomenon attributed to Cornwall. Particularly St. Ives.
Oh no, they're vicious here, as well as the kookaburras.
Yeah, I've lost an ice cream one, and Kenny lost an entire pasty.
Oh, do you know? I love them. I think they're amazing. I remember one of my favourite memories of my granddad. He'd saved the biggest chip, drenched in vinegar, and you could tell he was salivating at the prospect of this last chip at the bottom of his cone, and he drew it out, and he got it just to his lips, and this seagull went woof, and literally he felt the feathers across his face. He's like, "Oh, you bastard!" And my granddad never used to swear.
Oh my goodness,
he was gutted.
I didn't realize they'll come at you.
That's
Mhm.
crazy. That's scary. Welcome
Oh,
again
yeah.
to the Madhouse of
Sorry.
Seagulls and the Full Stop podcast.
Who knew?
We digress completely. Zoom always gets us somewhere talking at the start, doesn't it? And complaining about voices and recordings. How are you this morning, Gail?
I am good, thank you. How are all of you?
We're okay. We're
Good.
to be here. We're
And
good.
thank you for getting up so early.
Yeah.
Oh, absolutely. And as you know, I explained I have a new puppy. So I was up. I happened to be up today. That wasn't the plan. This was a last minute decision to adopt this new puppy about a week ago. So yeah.
They are
So
absolutely.
what sort of breed?
He's a mini Aussie.
Oh, okay.
Mini Australian Shepherd. And we have 3 others who are in the bedroom right now. But yeah, he is.
Oh gosh,
Oh,
Amazing.
well, he's quite
wow.
he's quite the handful. It's been a long time since we had a puppy, so yeah.
Yeah, in that case, you do know they're worth it, but just yeah.
Yes. They
Eventually,
absolutely are.
Yeah, and it does all sink in. Yeah, eventually, all those commands, they do come back after they've done the 2-year-old running around. Going, yeah, okay, good, lovely. You know that. I didn't know that.
Oh, okay. Yeah. We've always had I've always had a few dogs at a time. So, but I've never actually adopted a puppy.
Mm.
So the last 2 that we adopted, they were brother and sister. They were 8 months, which is still, puppy, but not that really puppy stage with the biting and
yeah, that's
so this has been a kind of a learning experience. I haven't dealt with this
I dealt with it in my A levels, and my grandparents, was it A levels? Can't remember when it was. And my grandparents had they've always had rescue dogs, and one of them arrived, and she had 12 puppies. So they had 1.14 dogs. Appeared in the local paper. They came around to take pictures, and if you can imagine the chaos of the newspaper reporter and the camera person trying to take a photograph of all these dogs.
Oh my gosh.
It was ridiculous. So I've always kind of gone, yeah, okay, no, I've done my time with that. But yeah, they are lovely, very, very lovely.
Yeah, and it's worth it in the end. So yeah,
it is. Yeah, totally worth it. Yes.
So I guess we should do introductions, really. So.
All right.
We're 10 minutes in.
I know. We've done ships, we've done dogs. So, Gail, I mean, obviously it might be many of our listeners may not be familiar with you and your work. So I was wondering if you could sort of talk a little bit about who you are and what you do and how you come to be on this podcast, I guess.
Sure, absolutely. So I'm Gail Miller. I'm ironically, if you want to say that, I am a maternal fetal medicine doctor. So I take care of women with high-risk pregnancies, which people never fail to point that out to me, that I am childless not by choice, and I still do this work, which is I do part-time. And I'm also a life coach for women who are childless not by choice, because that's my journey. And when I was at the point in my life, and I don't know if you want my whole story, but when I reached the point in my life where I was like, okay, I have to accept this, and I have to do the work through this. I had a wonderful therapist and a wonderful coach. Neither one was childless, and neither one fully understood what I was going through. My therapist even at one point said, oh, she didn't acknowledge that she didn't know. She actually said to me, oh, I know how you feel because I had a high-risk pregnancy. And I thought, okay, I would never minimize someone's grief over having a high-risk pregnancy, because that does cause grief as well. But no, you don't know what it feels like. you went home with twins. You don't know what it feels like to know that that will never happen for you. And so I actually worked with my therapist for family stuff and decided, okay, I'm not going to talk to her about this because she doesn't get it. And my coach, it said, I will never understand. I mean, nobody understands what anybody else is going through. We're each walking in, different path, different shoes. But, she acknowledged, this is not my experience, but I'm here to help you. And so what she helped me with was like, I learned how to kind of coach myself. And that's when I finally came to, okay, I can enjoy life again. It's not the life that I had planned at all, but I can enjoy life and also acknowledge that I'm still sad about this and I will have, triggers, etc. But I now need to help other people with this. And so that's when I said, okay, I want to become a coach because that's what helped me the most. And I'm not putting down therapists. My therapist was wonderful in other ways, but that was what helped me. And so I specifically went through training to become a life coach so that I could help women who are childless, not by choice. And, the life coaching is always in general. But in the meantime, I was studying on my own, reading about, the psychology, the emotions and all the studies on women and men who are childless, not by choice, not to exclude men, but coaching men is very different than women. And so because my life has been working with women and understanding at least how to speak to women and most women are like, you want to talk about your emotions, and most men are like, yeah, just get to the point. And don't really want to go through all the, and I am the kind of person who's like, yeah, let's go through all the stuff. And so my choice was to, work with women who are childless, not by choice. And that's what I do. But what has come up, what I had always heard from my patients, long time, would be those who would have, let's say pregnancy losses, and, now they are pregnant, but it is still a trauma. Even if you are now pregnant, even if you've gone through a successful pregnancy and you've had a child, having a pregnancy loss is a trauma, and you will feel the effects of that regardless. And they would tell me the things that doctors would say, doctors, nurses, it's everyone in healthcare. Oh, well, at least it was early. Or someone who had a stillbirth. Well, at least you didn't deliver the child, raise the child, and then lose it. There's no at least. There's pain. And so that was what I had experienced in, talking to my patients. And then as I was working with women who are now childless, not by choice, now I'm hearing the other stories that I'd also experienced, but thought, okay, it just must be me. And that was, the insensitive comments about being childless, the assumptions, the assumption that it's okay to bring it up when it's not even necessary for the appointment. And so that's when I've gathered these stories, and it's like, I have to say something about this. And so one night, it was actually, didn't have a puppy, but it was in the middle of the night. I woke up, couldn't sleep. I'm like, okay, I'm going to write this, and sent this article because I was really hoping, it's a healthcare forum. And so I was really hoping to reach people in healthcare so they would understand these things are not okay to say and to ask about, and these assumptions. And so that's what brought me to this topic. Yeah. Long-winded answer. So
No, it's a very interesting answer. It's interesting. I was reading the article, and it wasn't just childlessness, because you've got a foot in basically both camps, haven't you?
Yeah.
So you can kind of see, I guess, that holistic picture. But I guess what I took away from it was the fact that you could be going in with a sore throat, and then that becomes the topic of the questioning is, are you pregnant, or something along those lines. And I guess that's what stayed with me, was because I would imagine, and correct me if I'm wrong, Michael, please tell me if I'm wrong, if a chap goes in with a sore throat, are they going to be asking you about, I don't know, your genitalia? I wouldn't have thought so, because it's just irrelevant, isn't it?
No, they wouldn't.
But for women, apparently a sore throat means that then you can start asking very intrusive questions.
Yeah. Yes.
You had it at the dentist as well. When I've been to the dentist, literally just to walk in, and I actually walked out because it had no relevance to the fact that I was just signing into the practice, literally signing in as a new patient. And it was, are you at risk? Are you pregnant? Well, what's that got to do with signing up? Because actually, when we think about the process of signing up to the point where you might need your first appointment, could be that not now, but then, or maybe I am now, but not later. And it's sometimes the inquiry part as well. When you're actually just making a gentle inquiry, it can come up as a question, not actually when you're facing treatment as well, doesn't it? It's bizarre that we're asked so much.
Yes. What's interesting is that very recently, in a physician group that I'm in, someone anonymously, so I don't know this person, but posted asking like if the situation that happened was okay. And it happened to be a male. At a staff meeting, the practice manager brought up that coverage was now allowed for IVF. I don't know if that's the case where you are, but most places don't cover IVF, most insurance and most employers. And so this was a change, and she was bringing it up and explaining, and then said in front of everybody, brought up and said, well, hopefully, Dr. So-and-so, you won't need this coverage. Why is that? And so why is that okay? You're talking about something. I mean, there wasn't a question. It wasn't, this person said he's never brought this up before. There's, no issues that he knows of. He's not trying to have a child now. But why would you even joke about this? This is having a child, whether it's you conceive on your own or IVF, or you can't have a child. It is one of the most, if not the most personal of things. And so why do people think it's okay to talk about it and to just bring it up and ask about other people?
Comes up a lot actually recently in our Threads stuff. We've just joined Threads, and this is actually something that popped up, was that perception of it. And I was writing something the other day for World Childless Week, because they've got the childless in the media. And I was trying to do some research, and it's amazing how light-hearted, in a way, or joking, there's a kind of a humour about it. And I was going back and looking through it, and it was about Friends. I went back to the TV show Friends, and how it was literally delivered, the entire thing about the characters Monica and Chandler not being able to have children, as being kind of, it was done for punchlines. But actually, if you were in the position at the time when you couldn't, then you would feel it was, literally it was punch. And it was the lightheartedness of the whole thing, and the dismissiveness that I found just literally in an hour of research of what was readily available. How is infertility treated, and childlessness just generally in popular culture, particularly in the 90s? There was a kind of like a start of it coming into, I think, kind of popular culture, I guess, because of maybe what had happened in terms of IVF and Louise Brown, and then it became something that, you know, was put into narratives. But there were numerous examples. There's certainly, I think in America, quite a bit, you know, Friends, there was the X-Files, there's other things where they've picked up this story, but have literally gone, here's the thing, it's a big problem, now we're going to drop it and go on to something else because it's easy to get past. It was that perception of the ease of which people can kind of recover from it. And I think that still kind of lingers, I think, in people's minds, in workplaces and inappropriate places, because it's meant to be easy, and almost every single storyline ended up with a miracle or adoption. It becomes flimsy and light-hearted, and of course it's not. If people haven't been through it, they take where do they take it from? What they've seen and read in the media. It's scary.
Yeah, exactly. And as you said, it was kind of a joke. It turns into a joke. And in response to his post, because he posted asking, like, this was upsetting. And am I wrong to be upset? And what was more upsetting to me even was the hundreds of answers. And this is a physician group, so hundreds of answers from physicians. Oh, you're taking it too seriously. Don't, you know, you're too sensitive. And then I responded and I was like, no, I'm sorry. You are all wrong about this. And thankfully I had many people who responded to me saying, you know, exactly. But still the vast majority of these hundreds of replies from physicians, and I don't mean to be cutting down all of my colleagues, but the reality is in healthcare, it's used as a punchline or as it's just fertility status, reproductive history is just used as something, as a way to, you know, to establish rapport. Like in the general population, you know, people think, oh, asking about when are you going to have a baby or why don't you have kids or all of these questions, they think this is a way of getting to know someone, and it's benign, and it's anything but benign. But you would hope that people who are supposed to be caring for others would at least be open to understanding this is, you know, you're wrong about this, that this is not something you just use to establish rapport. This is a very sensitive topic. And so, yeah, it was really disturbing to see hundreds of responses telling this person, you're being too sensitive. Just take it as a joke. It's not a joke. It's personal, and you don't have the right to bring this up in front of anybody, much less all of the staff and my colleagues. And so, yeah, there's a lot of disturbing behaviors and questions and comments. And again, I'm talking, this happened to be a physician group, but you know, people hear this from the minute they walk in. Like you said, sometimes it's in a form, sometimes it's the receptionist just asking, you know, a medical assistant, a nurse, and no one stops to think how personal and how painful this could be for someone.
It's funny you say that, girl, because I remember, I think we're going to have to pop a trigger warning on this one, but I remember after my miscarriage, I had to go and get some antibiotics because I developed an infection, unfortunately. And I remember having to have repeated conversations with a receptionist around my medical issue. You know, why do you want this? What is this about? And I remember saying to them, with the greatest respect, you're not medically trained. You are just a receptionist. I don't want to keep having to repeat what is a very painful story in an office because I was at work. And I got this real sense as well that there was this pervading culture of the receptionist having a right to ask some very invasive questions of somebody that was clearly in distress to justify why I needed help at a time when I was actually feeling very vulnerable. And I wonder, I sort of look at it now and I wonder if there is, and I don't mean this to be quite so broad brush, But I wonder if there's like a pervading misogyny around the right to have that information and the right to ask those questions of a woman in a vulnerable situation. I wonder, how do you find that? Do you find that too broad brush? What do you think?
Oh, no, I think you hit the nail on the head.
Ah.
Yeah, I think there is just this overarching theme in society that one, women and men should have children. I mean, that's so for even those who are child free by choice, it's certainly not the same feeling when you're asked these questions, but they also, feel the uncomfortable, the discomfort, and it's, this is none of your business. But certainly when it's something that's painful to you, but there's just this worldwide view that is the most important thing in the world. And so, it's our business, and we need to push you, and we need to put our assumptions on you, and we need to put our judgment on you. And it shouldn't exist anywhere, but it certainly shouldn't exist in healthcare, because who then wants to go to a visit? Who wants to have to call when you're going to be prodded with questions that are not pertinent for someone who's scheduling? Or certainly, you have to explain, say, I had a miscarriage, this is what's going on now, but you shouldn't have, so they know like how much time. I mean, at least in the States, it's like, do you get 10 minutes or do you get a 20-minute appointment? Like, it's such limited time that you're allowed. So sometimes to that degree it's pertinent, but the continued questioning is not. It just isn't, especially since you will probably then have to repeat it, because they're going to have you talk to the nurse, and then they're going to have the nurse practitioner come out. And, it's just not necessary. And a little bit of empathy and sensitivity goes a long way. But it's just so lacking. The understanding of how painful and how personal this is just lacking.
Yeah, completely. I mean, just by context, I mean, so I had to have 3 conversations that day because they kept misplacing my notes. Oh yeah, we've made a note of it. Then the second time, yeah, sorry, we've misplaced it. And then the third time, I said, right, that's it. I'm driving down there, and I'm going to sit in the waiting room until one of you actually takes the time to talk to me properly, and somebody that is professionally trained. And I ended up making a complaint about it, and it didn't get very far, to be honest. There wasn't an awful lot of empathy in even considering the complaint. And I wouldn't usually complain about it. I mean, it's a waste of everybody's time, if I'm honest with you. But such was my distress at being asked those questions by somebody, 3 times. You don't really want it repeating again and again for other people that are in a similar position. And I'll be honest, the doctor wasn't much better. We ended up, I'm not religious, and that's absolutely no disrespect to anybody that is, but the conversation I had with the doctor was, well, God obviously didn't want your child to survive. And I was like, hang on, that's not the conversation we're having here. This one in the world, I don't want that brought in. I need you to be empathic and just sign me off work. That was the conversation. So it was all ends up and not a good experience. And as you quite rightly say, it put me off going to the doctors for a very long time afterwards. In fact, I still get anxiety now when I go into the doctor about something gynecological or non-gynecological, because I think, are they going to take me seriously? What is the conversation I'm going to end up having? Am I going to have to reference my childlessness, any of my infertility story? Just, last time I went in, it was for something innocuous. It was a skin thing. And I still had that anxiety. Are we going to end up talking about this? So
Sarah, I've had similar experiences to you. very similar, and actually still get very anxious going into the doctors. I'm just wondering how many of our listeners are the same. I really don't like going. You literally have to drag me there kicking and screaming because of the insensitivity, but also, again, I wasn't followed up on when I'd miscarried, and my issue was around the fact I had private IVF. Again, pop some triggers on here. So private IVF and also NHS IVF. But as far as the NHS goes, then the private IVF didn't count. But when it came to COVID, and of course vulnerability in my immune system, everything dropped through the net. So I had to sort of start to piece that story together myself. It wasn't relevant then, but of course there was a gap in all of the information at a time when, of course, the healthcare system was under stress. And I have huge empathy with people working, particularly, I think, specifically in this country with the NHS, and it's a terrible state of affairs at the moment, and absolutely thoroughly support and grateful for the NHS. But these pockets of problems, the fact that you, Sarah, have had an incident, I've had an incident, and neither of us like going to the doctor. I mean, no one likes going to the doctor, but when you've got all of this kind of mind sweary, stuff going on, mess and tangle in your head about something that, and you think, it's just even just going in and like the smell of the place, everything about it. One of the things I just wanted to ask is, we had a thing a couple of days ago, actually, that I was talking to somebody about, and about how people can move forward from that. What's the best, if you're in that situation and there is an issue, people often can feel like they have no agency, no power, nothing. Clearly, your writing is wonderful. That took much courage to do. How did that feel for you? And what would be your advice to anyone listening who's going, look, I've been in a situation, a bit like Sarah, a bit like Berenice, and I've seen it all play out in the way that you've talked about, Gail. What can I do? What is there any way forward? Anything that, I hate to say that victims have to educate people, because I hate that we have to explain that to people, but what's a good thing to do? What's a good action if people are into that situation and they find themselves really struggling? Sarah, I'm sure you've got some advice on this as well.
I'll let go.
Oh, okay. Well, not that I'm not happy to hear this, but it's comforting to know it's not just a US problem, that the visits with physicians, with healthcare, are often insensitive in general, unfortunately. And I was thinking it was just a US thing. So that doesn't make it okay that it's elsewhere too, but it's, I guess nice to, I don't know how to phrase that, but it's good to know it's not just a US problem. Now, that doesn't make it okay. So, it's a trigger going to, nobody wants to go to the doctor. I don't go to the doctor. And I've been in those situations as well, where they won't listen. They don't want to take the time. And I get it. I'm in practice still to a small degree. So I get that we don't have a lot of time, but there is a way to not make your patient feel like, they're just on this, production line. And there's a way to not make them feel like you don't have the time to listen to them. But that being said, that will take a whole lot of education of, healthcare. What I recommend, one is, I recommend writing out your history to the degree that you are comfortable with. But I always also say, it doesn't have to be detailed. You don't have to go through, how many cycles and of IVF you did, or if you want to, that's absolutely fine. But if that's triggering, I would just summarize your history. I had this many miscarriages. I would start at the top. this is a very sensitive topic for me. If it's not pertinent, if it's not relevant, please don't ask me. Here's the information that you need. And I would give that to either send that to them. Everything here is electronic. So I can send a note to my physician's office ahead of time if that's an option. But I would also walk in with that, print it out, and hand it to them. Now, we all know there are plenty of people who, no matter what you say, are not going to be sensitive to this or empathetic. And so you may still be faced with these comments and questions. The problem is when we're triggered, you get stunned, you don't know what to say, you're angry, you're frustrated, you're hurting, you want to cry, and you can't think of what to say, or you know what to say, but for some reason we feel like saying to someone else, a doctor or anybody else, that's not something I want to talk about, or it's not your business. We feel like we're being rude. I mean, that's what I hear. And I am the same way. And I hear this too. Well, I don't want to be rude. Well, that question or the comment is rude also. You are not being rude. You are setting a boundary. So and I do this before I go to events, family events, friend gathering, doctor's visits. I practice it's personal, I don't want to talk about it. I say it in my head, I practice it saying it to the mirror, so that when that situation comes up, I can take a step back, take a deep breath, and then be able to say, and my voice may be shaky, but I'm still able to remember, because I've practiced this so much, be able to say, that's not, that's personal, or whatever it is. I'm at the point, like, I'm old enough now and comfortable enough, and I've practiced enough that I'm okay with saying, that's not okay to say to me, or it's none of your business. That's hard for some people, and it comes with age and experience. For some people never get to that point. So figure out the wording beforehand that you will feel comfortable with when you've practiced. But definitely you need to, we think it's, what good is that going to do? But that visualization of you saying these things and then actually practicing it and saying it to a mirror over and over helps immensely when you're in that situation. It's not that you won't feel the sadness or the anger or the frustration and all the other emotions that come with this, but you'll be able to, it'll come out, roll off your tongue more easily. So, but I definitely highly recommend writing out your history and letting it know and saying, I want this on my record. I want this document on my record so that you know my history and I don't have to be asked every time.
I love that. Something I say to my clients, always practice your responses when you're not triggered, because your brain just goes, and you're like, what do I say?
Yeah.
Do I say too much? What do I say? But I love that. I think that's a really top tip, especially I'm the same. I can see them looking at my records, and you want something on the top, like a post-it note, don't you, saying, do not ask me about this, please. Endometriosis, that's my record. I think that's a brilliant idea. Thank you for that. It's a really top tip.
I love that. Thank you, Gail. That was such a brilliant answer. I'm sure that will make a lot of people feel that they've got more agency over themselves as well when they go into those situations.
Yeah. And I don't know what the records are like elsewhere, but here a lot of it is electronic, and there are sticky notes. Most of the programs have an electronic sticky note that says, that gives you that option to put in the things that patients don't want to talk about, that are, we're sensitive about this. So that I can't imagine that the electronic records in the UK and in Australia and elsewhere don't have that option, but there has to be a way to let them know it is absolutely fine to, and it's appropriate. It's a boundary that you are setting to tell your healthcare professional, I want this in my chart. So it is a flag that everyone will see. And it's okay to, and if you can't during the visit, because maybe face to face is difficult, or you're now triggered just because you're walking into the doctor's office, it's fine to send them a message or call them at a different time when you're not being triggered to say, I want this on my record. Please don't ask me about X, Y, and Z. And certainly if it's a paper chart, which I honestly miss, but I miss the days of paper charts. And we, at the front, we always were able to put a sticky saying, don't bring, this up with the patient, or they're sensitive about this. So there is always a way to do that. And you have every right to let your healthcare professional know that you want that documented on your chart.
Thank you, Gail. We just had a comment come in actually about changing from a male GP to a female one in order to address some of the issues that they were having around constantly being recommended the pill, which they said that they didn't want, but it kept coming up. So they changed to a female one. I know that's difficult for every sort of setting in terms of doctors and things, but I did that as well at one point. I changed away from that male GP to the female one, and I insisted on it because of what had happened. But that can be an option. Or alternatively, the other thing I did as well, because when I moved, I decided I was going to actually look at the ratings of the local GP, which you can do for the NHS in the UK. I don't know whether that's a facility in Australia or America or other countries, but it meant that actually I could look at the ratings and see what people were saying about each GP. And there was one that was more local that got some atrocious reviews, and the one that I'm with is further away, but it was actually good. And I've had some good experiences there with their locums and their GPs. So that can kind of give you back that empowerment as well, can't it? By going, do you know what? Let me go and have a look at the reviews. So yeah, thank you for that.
Michael, did you want to butt in? Sorry, I see your hand up.
Sorry, you got your hand up.
I'm going to take us off on a slightly different tack, but because it's not often we get a medical professional here. So there's a couple of experiences that both Vicky and I have had over the time, taking our own GP, taking our aging parents to different GPs, and we've been able to, between the two of us, bring up subjects about childlessness. And one of the things that our GPs have said, there's probably 3 or 4 of them, so it's not a large sample size, but they go, oh my God, what can you give us? Because we've got no resource. We don't have anything to point these people to who are childless. Is there anything you have? Is there any pamphlets or anything that we could give out? And that, to me, that was quite shocking, because I thought, really? Is in the medical profession, is childlessness actually a thing that is recognised? So I would really love to hear your opinion on that, Gail.
Yeah. No, it's not. I mean, that's bottom line. Is it really isn't. There's such a lack of understanding. So again, I'm in these physician groups, and there very often women are posting saying, I haven't found the right person. I'm, how many years old? Should I freeze my eggs? And everybody's, yes. Then you won't have to worry about it. I mean, even physicians don't recognize freezing your eggs is not a guarantee. There will often be people posting about the fertility struggles that they're having, and the answers are very glib. Just have IVF. I mean, there's really such a lack of understanding. And again, I don't know anything about, I don't understand a neurosurgeon. I don't understand what radiologists do, so I don't expect every other specialty to understand and know that IVF is not a guarantee. In fact, you're more likely not to get pregnant during a cycle, unfortunately. And so, no, they don't understand. And I cannot tell you how many, when I talk about what I do, and they say, well, are you childless? Yes, I am. And you can feel the discomfort, their discomfort. Like they're uncomfortable because you shouldn't, that there's something wrong with you, or, or the pity, which I greatly dislike. And so, no, there is a lack of understanding. I just started with a new gynecologist, and as nice as she was, and she took time to talk to me, she never once asked me, your child, and I didn't tell her what I do. She didn't even know I was a physician. She didn't know that I life coach. She doesn't know what I do. She didn't ask, is this a sensitive topic? Is this something you might want help with? And I've had women who are, menopausal, postmenopausal, who are childless, who never have had, and they are grieving, and no one is asking them at their visits, is this something you would like help with? And nobody's recognizing that some of the symptoms, are emotional. Our emotions often come out in physical symptoms, and nobody's putting those pieces together that, you could be feeling this way because you are grieving and you've never had help with this, but no one talks about it. Nobody asks about it. And you get the answers that are just very glib, or they become uncomfortable and they offer you pity and then they move on. It's like, I don't want your discomfort. I definitely don't want your pity, and I don't want you to move on. Or maybe I do. Maybe today I do. I don't want to talk about it, but at least give me the option of saying, can I help you in some way? Can I guide you to some resource, to a therapist, to a coach, to somebody? It doesn't even get addressed. And I recently gave a talk about this, about why you shouldn't be talking about the things not to say and not to ask. And it was meant for healthcare professionals, and they just don't want to hear about it. And they truly did not want to hear about it.
I know one of the things that still sticks with both Vicky and I is the very last time she went to see a gynecologist about the guy who did all the IVF for us. He sort of said, well, look, you probably need to give up. Well, Vicky was close to 40, and he's gone, you probably, you probably need to stop now. And, she was obviously not gobsmacked, didn't know what to say about it. That's as we all know, a very, very big life decision. And she walked out of his rooms with no plan, no support, no nothing. And that was, it took us 10 years to figure that out. There was nothing that we did. But it was, it's the medical profession, and I'm not smashing the medical profession at all. But there is certainly a huge gap.
That was an experience. Oh God, this is terrible, isn't it? And Sydney goes, me too. But we walked out of the clinic and it was just like, your eggs are scrambled. I was told the word scrambled. There's just nothing. There was just this gap. I had nothing. And actually, I don't know about you, Michael, but certainly with us, it was, if you want counselling, you have to go back to the place where you suffer this trauma, because there wasn't counselling anywhere else. I mean, this is what's so wonderful about your coaching, Gail and Sarah, the work you do, and all the other counsellors and coaches out there, is that there is now we can find that. But certainly my experience was that I don't want to go back to the place where really my life fell apart in order to have someone tell me in that building. I mean, the connotation of the building itself is really hard, and actually just driving down that road again is so hard. And there just wasn't anything. It was just, there you go. No plan, as you say. There's nothing. There's no real kind of like aftercare. I remember having to come off all these tablets and being utterly incapable of being able to count them, and having to say to my husband, can you please do that? I don't know how to do this. I don't know how I'm meant to do this kind of cold turkey thing. I don't know what that's like. I don't know what I'm doing. And there's no one to ask. And certainly, again, there's so many trigger warnings, and I'm so sorry to anyone who's triggering, but also, again, things like taking injections and just gently touching again on COVID and having to have the vaccine and needle phobia, because the last time I had a needle near me was because of infertility. Going in and having my vaccine done with volunteers who clearly were brilliant at what they were doing, and my God, they were wonderful, they were amazing, but I had to go in and sit there and say, I'm really not comfortable, and I can feel it now, actually, sitting and talking about it. I can feel this is hard. And I remember sitting, having the vaccine, and I think the enormity of the situation that we were in as a world, but also my little world, where it was hard, and knowing there are other women the same, and just sat there, and they said, you have to sit for your 20 minutes or however long it was, and you can't. I couldn't, because actually if I just go home, I'd just be sitting there. I'd be going all the way home in tears. So I just sat there in the corner of this thing and crying, and someone came up to me and he said, are you all right? And I just said, well, actually, I'm finding it traumatic because. And he said, oh, well, you never know. Try again. And it was just like, oh, God. Anyway, I ran out of any energy. Normally, because I suppose because of podcasts, because of being sometimes being a bit gobby about these things, I might say, actually, that is really inappropriate. But by that point, I literally nah, I'm just going to go home. I just had to go home. And again, it's kind of in talking about that, even out there in the world, and saying that this thing is a traumatic thing. It was a case of, you should be grateful for the vaccine. And it's not that I'm not grateful for the vaccine. It's actually, the situation that people were in at the time. And that, again, some of that trauma around needles, again, I think people with needle phobia in general are having problems, but again, people can have a connotation with needles for different things. And I think that doesn't really ever get touched on as a problem. But it's remarkable, isn't it, how we are just thrown out there, somehow left to cope, when actually picking us all up and doing something could be incredibly empowering. Certainly could reduce an awful lot of mental health trauma, because I suspect if you get chucked out of one part of healthcare, you end up coming back into it in another way. And then, of course, we end up talking to counsellors. We may end up with more time off work because we can't cope so well. And so it's kind of like a roundabout kind of circle, isn't it, somehow, with all of this. Pretty hard. Yeah.
I guess I'm just gobsmacked at the fact that this isn't recognised by a medical profession that you assume would know about this. There's almost like a squeamishness about it. I think that comes through. And I was reading, it was a little while ago, but that endometriosis is prolific in numbers as diabetes. But there's this kind of squeamishness when it comes to talking around female gynecological health, and also, talking about chaps as well, breast cancer. Men can get breast cancer, but there's no conversations around that. There's almost, but when it comes to childlessness, this complete blank. Whereas, we know, everyone that's been through IVF and people that I talk to know that there's a high probability of it not working. So it's baffling to me that actually this is just such a blind spot.
came up on the female lead actually on LinkedIn the other day, and I had to go in and sit and crash out some words because it was, it's a major kind of big thing on LinkedIn, the female lead, and they had a poll. Are you considering egg freezing? Yes, no. And it was just like, oh my God. And I thought, no, I tried to keep it professional on LinkedIn because one should, but no, actually, this is just so fucking wrong that, again, you're leading to this myth. I mean, the whole account just annoys me, but occasionally just go in and just have to right some wrongs and misperceptions. Is that this is not something you just kind of nip out and do. And it comes as more of us that doesn't work for than there are that do. The statistics tell us that.
Yeah,
it's ridiculous. Michael, can I ask a quick question of you? And just in men and men's healthcare, would you, putting your question back to you and Gail's answer, would you be comfortable as a guy going to your surgery, to your doctor, and saying, look, that approach of this is what's happened to me and to my wife, here's my notes, does that level of sensitivity, is that also kind of a difference in genders? Would you be comfortable with that? Do you think men would be? Did that work for you?
I can only really talk for myself, and just say that, yeah, look, I guess age, knowing ailments, I don't think I'd have a problem with that, to be quite honest. I'd be quite upfront with, if we're going to talk about this, we're going to talk about it. If we're not, we're not. But I think that's, look, I think there's a whole different dynamic there for me. Like if I go to my GP now, she's an exceptionally empathetic woman. So I don't need to worry about that sort of thing. But if I don't think I'd have problems with, being upfront with anyone else. If does that answer your question?
Yeah, it does.
I
was thinking about the sort of perceptions, because I know that the conversations I've had along the way, thanks to being a friendship with you and also my husband as well, and just thinking of how that sometimes plays around, and going back to Sarah's point as well about the general misogyny and how people are treated, I think as well. So just an interesting observation as to how it
goes back to what Gail said about, men just want to get to the point. So I just go to the doctor, go, right, this is what's happening, this, and he or she will go, all right, we might have to do some bloods, we may have to go for a test, or we may have to do this. Thank you very much. I'm gone.
Thank you. Yeah, it is just a difference, isn't it, in how
That's it.
Yeah, I mean, it's just like, here's my bit. I was equated to my husband. I fix it. That's it, isn't it?
We'll take the recent heart thing. So there was someone who, they probably won't listen to this. So my brother had a heart attack at quite a young age. And so that sent the fear for everyone, especially me, similar genetic makeup. It's like, whoa. So I've gone to the doctor, said, right, this is what's happened. This is what happened to him. What can we do? How can we investigate this? So I'm in front of the ball. And she's just gone, go and see him. 5 minutes later, I'm out of there. And I've gone to see a specialist and we're doing an investigation. That's what a doctor's appointment's like for me.
Wow, bish, bash, bosh. There's so much more than that for me. I'll be going in like with me anxiety and like, oh God, what am I going to be asked? And here's what's happening.
I'll be freaking out. It'll be like a whole mental health trip.
Bish, bash, bosh here.
But don't get me wrong. There's anxiety there because I'm going in there thinking about, am I going to have a heart attack? Is my life coming to a close? So there's anxiety, but through the activity of going to do that is some reassurance or way for me to work that out. Yeah, if that makes sense.
Yeah, completely.
Yeah, wow. It sounds like you got to the point with it. This is what's happened, and this is what I want to do, and I would go in with, a story. and and then after, like, 5-10 minutes, get to the point of, yeah, I have this family history, and so this is what I'm concerned about. Not all, but men typically, like, get to the point. And women, including myself, like, oh, I want to talk a little story first.
So talking about stories, Gail, you did a TEDx talk, didn't you?
I did.
What was that experience like?
So I will tell you that people are commonly afraid of public speaking. Me, to the point of, it wasn't just public speaking. I just didn't want to be in front of anybody, this is long before Zoom, and so even if I had to stand up on a podium with other people and I'm not speaking anything, I couldn't. And I decided I had this message and I needed to push through my fear and do this. And so it was two purposes to this TEDx talk. Was one, I want this message to get out, and two, I need to get past this fear. So it was so empowering. It was working through the talk, writing it, working through my story, writing it, and trying to get the message out so that there was an understanding. One, I wanted to include childless not by choice, but also for people to recognize that everyone experiences loss. Let's not minimize that. And also, you are normal for having the feelings that come with loss. I'm very anti-toxic positivity. If you haven't heard I'm very anti-toxic positivity. I'm going to leave it at that. And so it was very empowering to be able to get this message across, to talk about childlessness, to talk about allowing feelings, to talk about not minimizing this and telling someone to just, move on. And in the middle of the talk I was absolutely terrified, but in the middle of it, I was like, I'm having fun. And so it was an amazing thing for me, because I just never envisioned myself having fun public speaking. I was nervous, but just the empowerment of getting this message across overcame the nervousness. And my voice, you may not recognize it, but it was shaky as I listened to it, but not as shaky as it has been in the past when I've, when you go through residency and all that, you have to give talks, and oh man, like, typically when you're a resident, when you're in training or a fellow and you're giving talks, the older physicians will grill you with questions afterwards. And they would never do that to me because my voice was shaking so badly. He pitied me. So nobody would bombard me with the questions. So this talk, when I listen to it, I'm like, I hear the shakiness, but others don't, because it's not what I used to experience. I don't know if that answered your question, but it was an amazing experience. To the point where I'd like to do another one.
No, that's what I wanted. I just wanted your perspective on what it was like. So congratulations and kudos to you for challenging that fear that you have. Thank
you. And for anybody else who has a message that whether it's to do with childlessness or anything else, I highly, highly recommend doing a TEDx talk, because it is empowering to know you have this audience listening to your message, and it's an important message. So I highly recommend it.
Nominating on TEDx. I think that's how you do it. I think that's I can't remember the process. I don't think they pick you. You can nominate people, though. I have to nominate you again, Gail, so you get a second go.
Oh, thank you.
We've had some stuff in some comments in the chat as well since we've been talking, and we don't name people, but the person who's put this comment actually I know works for the NHS and has said that not all notes are electronic in the UK, so it might well be that it's different in other countries as well. And you could tell your gynecologist you don't want to speak about something, but if you went to see another specialty, then you cannot look through all of the previous records and they're told that it's not an area of expertise, then they can't necessarily look at that area. So if you went presumably for one particular thing to do with gynecology, if you went for something else, they may well ask you again because they wouldn't have access to that particular part of the file. I think I'm right in summarizing that. I'm hoping that this person put some comments back if not, but also that it's not actually shared between different areas as well. So if you're treated in Kent and you went to Scotland, the hospital in Scotland might not know your medical records. So it feels like the answer there is probably that sounds awful, but you have to kind of keep this paper, this printout with you. That's pretty tough to do, but maybe that's the answer to that. But that's not, again, possibly not so efficient as it's in the US, and that obviously will vary, I guess, in different countries around the world, bearing in mind where all of our listeners come from too. But also to touch on another comment, which is that, of course, people who, like you, work in healthcare having to ask those questions themselves because they have to as well. And this person is saying that they have to ask because of about children due to genetic links in cancer care, and that's really hard. And again, another area that needs support. It's the staff within and patients too. It's both ways, isn't it?
It is.
That contribution. Those questions are really, really great, and there's observations as well.
Yeah. And so when I've given this lecture to healthcare professionals about how you have this conversation, I always tell them, just because someone doesn't want to talk about it, sometimes you still need to, like, for instance, if there's genetic risks for cancer or other diseases, but there's a way to present it where you explain first. You don't just, oh, so do you have any X, Y, and Z? Just a very simple, this may be something sensitive to you, but this is why I have to ask about it. Again, when I explain this, physicians often don't want to hear that. It's like, it's just a simple statement showing some sensitivity and explaining to someone why it's needed, because we often don't know. I mean, I've been asked things as a physician from another specialty. They're asking me, and I'm thinking, why do you need to know this? And I said, why are you asking me this? And they explain, but tell me first, even if it doesn't have to do with fertility issues or childlessness. There's really no reason why we can't stop and think that you didn't go to medical school or whatever your field, if you're a nurse practitioner, whatever, this person didn't go through that. They're not going to know why you're asking this. But unfortunately in healthcare, they don't want to hear this, but it is a very simple, this may be sensitive for you. This is why I have to ask about it.
Yeah. It's not like that victim again, isn't it? I hate to use the word victim, it's not the right word, but I can't think of another one off the top of my head, but it's where we have to then ask or explain, when actually, if it was the other way around, it's just alleviates some of that pressure. Yeah.
Well, I guess it also, context helps us understand why they need it, because we've come into this gone, well, we've got scenarios where they don't need it, and then that that gets us, I guess, defensive or, trying to protect ourselves. But actually, like the example we had, if you're unfortunately having cancer treatment, you need to have that question to go, look, we need to know whether you potentially passed it on to somebody else through genetics. That to me, okay, that makes sense. Okay, I can take off my protective armor now and I can answer that question. So that makes sense to me. Yeah. What's your future plans then, Gal? Have you got anything coming up where you're talking about this further? Because it's such a fascinating topic, isn't it?
It is. I don't have anything scheduled, but I'm working with some people to bring this to light, because it's as I'm doing more coaching and hearing more stories, I get more infuriated. And so my way of dealing with that is I need to change the system. And so that's what, even a simple, I've had people complain, understandably, that, they ask me if I'm pregnant or trying to get pregnant, and nobody explained that the reason that they're asking is because they're ordering an X-ray. Again, a very simple, I have to ask because we're ordering an X-ray and we need to know if you're pregnant. Or I'm ordering this medication. I need to know if it's going to potentially affect a pregnancy. It takes 5 seconds to say that. And so if you can't tell, I'm very passionate about how you communicate with patients in terms of reproductive history and in general, just because I share the frustrations as a patient, but also as hearing from my patients, my clients, about the really insensitive behaviors and approaches to healthcare visits. So it's a topic that's, just even, my husband had surgery, as I said, recently, and the doctor said to him before the surgery, I was sitting there with him and I heard it, you won't have any pain after. And right before, that was a visit before the surgery. And then the day of, in the pre-op area, she said the same thing. Again, she doesn't know I'm a physician. And each time I'm thinking, I know what you're going to be doing. It's not my specialty, but I know what you're going to be doing. You're taking a piece of an organ out. You're using all this, doing all this manipulation on his body. And how can that not hurt? And it was and he did. And he went, afterwards, he was shocked that he was in pain, in significant pain. And I was so furious afterwards that this doctor has obviously never talked to her patients afterwards and really understood what they go through. So it's something I'm very passionate about. When it comes to childlessness, but also in general.
I love that. It is managing expectations, isn't it? Even if it's not the childlessness stuff, it's that being honest, isn't it? Yeah, you're going to be in a bit of pain, I'm afraid. We've been tinkering with your organs. I'm afraid it's going to hurt. But I think it's all of that really sort of permeates through when you combine it with the squeamishness and the blind spots, and it makes for a very frustrating, triggering experience for people that haven't been able to have children, don't necessarily understand the process that they're going through or why they're being asked it. And my work with clients and my experience has been, you have to slap the armor on and you're waiting for the trigger. So as soon as they say that question, do you have children? Why do you want to know? And you're instantly defensive because you're like, what's that got to do with anything? So it's kind of almost like a meeting in the middle. If your communication is good, I then understand why you're asking, and then perhaps I don't need to slap the armor on. I can be okay with it. But it's a fascinating area. It's so, obviously with the number of people in this community, it impacts so many people. It's just such an invisible topic, isn't it?
It is. Yeah, it really is. So I am going to keep writing about it and keep talking about it because it's, obviously near and dear to my heart. But, if I can just change one healthcare professional at a time, more would be better, but I'll start with one at a time.
I love that. Just got to picture us with pom-poms on going, yay, go girl, go girl.
Oh, I'm going to keep that in my head, yeah.
I think everyone in our chat will be very, very keen to do that too with you. It's going a bit wild.
Can I just put it out there? I won't be use pom-poms, but I want a t-shirt. Gail Miller. All right?
Oh, you look great in pom-poms.
You're fine. Thank you so much, Gail. We're going to stop recording now so that we can invite anyone in. Thank you for listening. We hope you found Gail's work as inspiring as we did. By members of our Full Stop community in our audience, some of whom work in the NHS and in healthcare across Europe and other parts of the world, and we've shared some of their questions in our audio. After we ended the recording, they had a powerful discussion with Gail and lots of ideas took shape. And we're keeping in touch with everyone to find out more. And you're welcome to contact Gail or us if you'd like to create change with us. All the details are on our show notes on our website, www.thefullstoppod.com. Here you can also sign up for our Listeners List newsletter, which keeps you up to date with what's going on in our world. And you can find out more about joining the Full Stop community. As ever, it's important for us to let you know you are not alone. Sounds like a good point to close on pom-poms.
Yes, I love that. Closing on pom-poms.
Why not?